Hello my friend, welcome to medical science class. As a student of medical science, I want to take favorite backgrounds of science. What kind of things say do that is bad, that is knowledge, that is details, and that is good art design. As a Muslim, Allah is the one and only creator. Sabala or Krishna, last and best messenger. Namaste, Pasha. Ya Ali, Lam, Lam. Ya Allah, Shafi, Allah, Mafi, Ya Kapi. Ana Abdul Muhammad Shul, Kapi. Ana Abdul Muhammad Shul, Mafi. Ana Abdul Muhammad Shul, Kapi. Medical science class we discuss elaborated about heart. What is heart? Heart is a circulatory organ of human. Human heart is a circulatory organ, circulate the blood. Main action of the heart, circulating of the blood. Heart have four chamber, right atrium, right atrium, left atrium, right ventricle, left ventricle. In case of creator name, as a Muslim I say Allah, Alif, Lam, Lam, Allah. 4 alphabet. Also position of the heart look like Arabic ear. What type of ear? Ya Allah. That is the logo sign of the heart, creator feel. Every human. In case of heartbeat, labda. It amplifies that the sound. La ilaha illallah, durud. Durud, every is, every prophet. In case of our is Muhammad ibn Abdullah. In atrium there is a sinoatrial node, autorhythmicity. Heart automatically pumping. That is called autorhythmicity. In case of heart, muscle, before muscle there is a covering, pericardial covering. That is called parietal pericardium. In heart to the heart covering to heart muscle, that is the visceral pericardium. And muscle 3 layer visceral pericardium, myocardium, endocardium, outer 2 in one. And parietal and visceral pericardium is, there is a fluid, remaining fluid. Fine. That is the protest heart from any problem. Now heart and right atrium, superior vena cava, inferior vena cava, superior vena cava and inferior vena cava drain in right atrium. Heart then from blood, right atrium to right ventricle by the tricuspid valve. From right ventricle to pulmonary trunk. Pulmonary trunk, pulmonary artery. Go to the lung, deoxygenated blood. Oxygenated from lung, oxygenated blood, then deoxygenated blood, oxygenated in lung. From lung, 4 pulmonary vein drain in left atrium. Then left atrium oxygenated blood go to the left ventricle. Left ventricle to ascending aorta, arch of aorta, descending thoracic aorta. Descending thoracic aorta go to the pass to the abdomen and lower part. And ascending arch of aorta 3 parts. Brachiocephalic trunk, left common carotid, left subclave. Brachiocephalic trunk give the right common carotid, right subclave, upper part of the blood circulation. Now heart anatomy. And heart have 4 valves: tricuspid valve, bicuspid or mitral valve, pulmonary valve, aortic valve, and also extra 2 valves: superior vena cava, inferior vena cava. This common. And common disease of the heart attack. Commonly we say heart attack. What is the heart attack? When blood supply or oxygen supply reduced to the heart and oxygen need reduced to the heart, then if fuel reduced to the heart and muscle, pericardium, myocardium and cell, and in that cell, heart cell look like spindle. In case of slide spindle with spindle like fine. In histopathology, see that histopathology. Fine. Now in heart cell is a fuel. Every cell need fuel, glucose and oxygen. If oxygen reduced to the heart, oxygen supply reduced to the heart, any region, for example, for understanding purpose, ascending aorta there is a two artery, right coronary artery, left coronary artery. From right coronary artery supply, from right coronary there is a marginal branch, left coronary artery is circumferential branch, right interventricular, anterior interventricular branch in interventricular septum, and posterior interventricular branch give the posterior interventricular septum. That is the heart artery supply. And heart vein supply, coronary sinus. Now heart. If any region oxygenated blood is reduced to the heart attack occur. Commonly occur, there is a block of coronary artery, right or left coronary artery. What is that? By the reason of any reason, infection, tear, or atherosclerosis or atheroscloma, chorby in coronary artery block there. By this operation, what do we do? The treatment, common treatment, antiplatelet drug. In case of heart attack, 4 aspirin. 4 aspirin or 4 aspirin antiplatelet drug, 4 tab straight, 353, 4 aspirin, 375 milligram, 4 tab straight. Antiplatelet drug. Commonly used if any heart attack occur, you given the antiplatelet drug like 4 aspirin. And if you give natural heparin, anticoagulant, the magic occur. What is it? The magic occur. Natural heparin, what is the natural heparin? That is naturally anticoagulant. If given IV, the heart attack reduces. If block 90% of the artery, coronary artery, then the treatment is angioplasty. By your vein, go to the inferior vena cava and go to the artery, coronary artery, and there is a ring, stent, fit to the expand the artery. And dual drug is lipid lowering agent, and reduce the fat intake. That is the treatment protocol of heart attack commonly. Now my friend supporter, understand, today is enough from medical science class. We discuss it later about next class. But if glucose reduce, what happens? If glucose, oxygen and glucose both is necessary to cell ATP. If glucose is then also in diabetic patient heart can problem. Not only heart but also any organ can problem. Today is enough from those are diabetic patient for them. Today is enough from medical science class. I am MSC. Even if you MSC, MSC 007.